In this scenario, we'll be seeing Deborah, who will be treating a patient, Nikki, who will be playing the part of somebody with Down syndrome.
I would say gaining their trust is a big issue.
I'm Deborah, I'm one of the dentists.
Hi.
If they're comfortable with you initially, they tend to not do what you say, but they're more compliant with what you want them to do.
Have a little look at your teeth today.
No.
No?
No, that's right.
Oh, I've got a lovely fancy chair.
I know you got a chair, but I'm not interested.
It goes up and down and back and forward.
No, I got one.
So I like initially to get to know a patient with special needs.
Who's your favourite singer?
Britney Spears.
Britney Spears. Oh, I love her too.
They often have an interest that they are very passionate about.
Okay. Mine is Oops, I Did It Again. Do you like that one?
Yes, I love that one.
And if you can get to that interest, then that's the first step to gaining their trust.
Love to, let's go.
Excellent, let's go.
You have to take things slowly and think, how does the setting look to someone with special needs?
Do you want to have a try?
No, I don't want to.
You don't want to have a try?
I don't want to. I want to do it.
So you have to try and make things nice and happy, nice and friendly.
What about Chris? What do you think? Will we let Chris have a try?
Yes.
Try and see the world through their eyes, I guess.
Really easy.
Legs up.
Pop your legs up and then look at this.
There we go.
Goes back like you're lying on the beach. What do you think?
Yeah.
Do you think you can give it a try?
Yep.
Yeah.
I'll give it a shot.
Okay.
If they're with a regular carer who they trust, them kind of demonstrating how things are done can often be helpful. And if you keep it that way, that yes, this is exactly what's going to happen, then that will relax them, and you're not going to be freaking them out with something that you haven't already demonstrated to them is going to happen.
Yep, so what we're going to do now is have a look at your teeth. All right? Can you open your mouth for me? Can you open up your mouth for me? Let me show you my mirror. This is my little mirror, so that I
Don't touch me!
so that I can count all your.
I said don't touch me!
Okay.
It's okay, Nikki.
What if we have Pearl holding your hand?
It's okay, Nikki.
Okay. So now I'm just going to count to 5, and that'll be you finished if you can open up your mouth.
There's always a way around any situation that
Open
happens.
up your mouth.
Patient goes away happy, having had their examination, their oral hygiene improves,
1,
and they go from a patient with special needs
2,
to a regular patient.
Doing well, Nikki.
3.
I always walk away from work feeling very happy.
Brilliant, Nikki. You've got beautiful teeth.
Sometimes you've just got to take it a bit slower with them, walk them through step by step and just put them at ease. Another thing is our clinical attire, masks, safety glasses, gloves. Sometimes you do need to just dress down a little bit to remove the clinical side of it, the smell of the clinics as well, even down to the looks of the clinic. I guess you need to be a bit flexible when you're working with patients with special needs.
There's a whole lot of myths that surround people with intellectual disability. There's a whole spectrum, for instance in autism, the mild patients are certainly within your capability and practice. The other thing is somebody who's in a wheelchair, somebody who's physically disabled, there's no assumption that they have any cognitive or intellectual deficit at all. Some other myths surround those of communication issues. If you have a communication issue, it doesn't necessarily mean that you have a cognitive impairment. You may actually be able to advocate and consent to your own treatment
If the patient is cognitively able to consent for themselves, that would be the most preferable option, and that's where I'd start. If the person have got intellectual disability or unable for whatever reason to consent for themselves, the next option is to establish who is the medical power of attorney. Third step, if there's no medical power of attorney, there's no next of kin, will be the Office of Public Advocate. And we make a contact with them. There is specific forms called 42K. It's important to remember it's 42K, not M, because the M is the medical version. And the form, at the beginning, it might seem a bit tedious to fill it, but it is just making sure that you're acting in the best interest of the patient.
Hi, I'm Christine.
In this scenario, I'll be treating Scott, who will be playing a patient who has autism.
And he's just getting really upset the
Okay.
further we've got driven along.
It's Scott, isn't it?
Yeah.
Yeah, Scott. I'm Warren.
Okay. Scott?
Hey, Scott. Scott, I'm Warren. How are you? I'm the dentist. I'm going to have a look at your teeth. So we're going to go up into the clinic now. You'll be okay. Christine will be with you. All right?
So I'll come up with you, Scott,
Yeah.
and we'll get Warren to have a look and see how things are going and what he can do for that pain, all right?
Good one.
Great.
Excellent.
That's
Oh,
fantastic. Really
Over
good.
this way. So here we are.
So here's our chair if you'd like to come and take a seat.
Okay, Scott, you have to sit down and Warren can have a look and see how we're going.
Sorry. Okay. Scott, so tell me about what's going on in your mouth. You've got some pain in your tooth? You're showing me, is that left
Been
side?
touching his face for the last couple of days, but we're just not sure whether it's top or bottom, but it's been that same side.
On the left, is it? Do you think it's on the left, Scott? Okay. Is it sore on that side, on the left? Yep. Scott, do you reckon it's the top tooth or do you reckon it's the bottom one? Top, yeah? Yeah, top.
Not sure.
So what say we have a look-see? Amy and I put a mask on and some gloves and stuff. Christine's going to just step in here. I'm going to wash my hands with Amy.
Okay, Warren's just going to wash his hands and put a mask and gloves on, and then he's going to come and have a look and we'll see what we can do for you, okay? Now Amy just wants to fix you up now.
Okay, Scott, so I've just got this bib that we're going to pop on, okay, just to keep your jacket nice and clean. Is that okay? Beautiful. Now we've also got some sunglasses here that we need you to put on, just so that way your eyes are protected from the big light we've got to use. Do you want to pop those on for us? Good man.
Okay, that's really good. Now Warren will be back in just a couple of minutes, okay?
Okay, Scott, we're going to have a look at this tooth. The mirror's going to go. I think the person who has an intellectual disability, despite that disability, has lumps and bumps and toothaches just like everyone else. And if you've established that rapport, communication and cooperation, there's every reason that you should be able to do the clinical phase and the management for that patient and alleviate them of their pain and set up a clinical pathway that is going to ensure their oral and dental health and well-being in the future. They should have regular recalls and checkups and prevent disease in a regular program that you would for any other patient.
I don't have the right word exactly for it, but I think gratification, self-satisfaction, and you can use the word rewarding there. But I would say it's personally you grow a lot.
It might be challenging. It might be, needing more time or whatever, but the, rewards outweighs any of these challenges. And once you get involved, you'll get hooked. You will not be able to get out of the group of special needs because it's so rewarding.
You do become emotionally involved sometimes. It's very hard to shut off the emotional side of it. The empathy that you can develop with them, and definitely the bond that you get with them as well is the most rewarding thing you could ever do.
When I wake up in the morning and look forward to my day at work, I think about what are the challenges in treating people with special needs. It's no cakewalk, but really what you put in is what you get out. And that little effort pays back in spades. You've done something that's positive to a group that has certainly strong identified needs, and the benefits can go on and on for those patients over a longer period of time. If you'll find yourself in the right supportive environment with carers and staff and mentors on board, it's a great journey. And really, the rest is up to you.